So currently the United States really faces a very serious fiscal problem. We are around $40 trillion in debt. We are running deficits of $2 trillion. You understand that in context. We spend $7 trillion a year, we bring in $5 trillion in revenues, and then we have that enormous gap between our expenditures and revenues that is the deficit. We are hitting a point where the interest payments on our debt are starting to consume a larger and larger share of our budget. Right now we are spending more on our interest payments than we spend on national defense. And this is one of those markers that people who look historically at the rise and fall of great nations often point out that when a nation starts spending more on financing the debt than they do on national security, that is a real danger sign that they will not continue to be a great nation going forward. So what everybody needs to understand is that if we hit a crisis, it will be an enormous loss of wealth for everyone, with significantly growing interest rates, hyperinflation, or some combination of both. What this will mean is that it will be very hard to start a business. Many businesses will fail. It will be very hard to get loans. It'll be very hard to buy a home. It'll be hard to grow a business, refinance, all of those things. And this will not be a crisis that happens just for 1 year and we can knock ourselves out of it. It is one that will take decades to get out of. And we've seen that in other countries, Greece, Argentina, other countries that have really faced a similar type of crisis. So people need to understand this must be addressed. We do not want it to be addressed in an uncontrolled fashion through an economic crisis. We want it to be addressed through disciplined decision-making that reduces the deficit and brings down the debt. We're going to pay for this one way or another. First, you have to understand what we spend money on. So if you were to draw a pie, half of that pie is composed of three things: interest on the debt, Social Security, and Medicare. Right? And those are the parts of our budget that are growing very, very rapidly. Another quarter of our budget is other mandatory spending. So it's things like Medicaid, health care for children, food stamps, student loans, things like that, mandatory. The last 25% is called discretionary spending, and that in turn is split in half between spending on national defense and everything else. So when we talk about tackling this, we have to think about the parts that are really growing. So healthcare is one of the hardest areas we really have to tackle, and anybody who's followed the history of public policy in this country knows that we have tried many, many different times to get our arms around healthcare in this country. Medicare, which is health insurance for people who are, largely for people who are 65 and older, is part of that. There are many, many ideas out there about how to do it, and just to talk about a few of them so people have an idea about the flavor of them. One is to reduce reimbursement rates for different healthcare costs. One popular idea is called site-neutral payments. So we currently reimburse procedures that are provided at a doctor's office at a lower rate than if that were provided at a hospital. So one idea is to bring those two into alignment, and that will save us, a couple $100 billion, right? Over 10 years, okay? So bringing that back to 1 year, $10 billion or something like that. So helpful. Another one is to reduce some of the payments to Medicare Advantage. There are challenges called upcoding. By addressing some of those problems, that can also save us, potentially hundreds of billions of dollars a year. So Social Security can be addressed either by cutting benefits or raising revenues, or in essence, some combination of both. If you think about the proposals that have been put on the table, and there are variations in all sorts of different combinations, there is most likely going to be some curtailing of benefits, whether it's means testing or increasing the retirement age. Those are different solutions that have been put on the table. Some of the revenue solutions are things like increasing the payroll tax or increasing the income cap. And then revenues, right? We are currently taxing at around 17% of gross domestic product, so 17% of our economy is sort of what our tax revenues are equivalent to. when we were in balance, it was closer to 19%. So one of the other things we have to think about is how can we lift revenues? It's not going to cover the entire gap, but lift revenues some to try to help us close the deficit. Okay, a $2 trillion deficit, we're going to have to touch Social Security, Medicare, and revenues to try to start bringing that down. So Concord Coalition doesn't advocate for a particular solution, but it does advocate for getting to a solution, okay? And so as such, we put different ideas out there on the table, not saying adopt one or the other, but we want people to understand what options are and also understand the scale of them.